I hope I am audible to you clearly. Good evening to all. I hope I am audible you clearly. Good evening to all. I hope I am audible you clearly. Good evening to all. I hope I am audible you clearly. Good evening to all. I hope I am audible you clearly. Good evening to all. I hope I am audible you clearly. Good evening to all. I hope I am audible you clearly. Everybody, please come. Please come fast. I hope I am audible you clearly. Good evening to all. I hope I am audible you clearly. Please come live. We are going to start the session. Everybody, please come live. We are going to start the session. We have already seen yesterday, right? We have seen the classification. We have seen the we have seen the classification. We have seen the classification. We have seen the then we have seen the inflammation. What are the inflammation? What are the different pathways? What are the effect of Nsaids? We have seen the effect of Nsaids in different conditions. So remember, they are used in the Bartter syndrome. They are used in the pre-eclamptic toxemia. Also useful in the patent ductus arteriosus, and they also have anti-hypofertility effect. So after that, we have seen the salicylic acid and the details about the salicylic acid. Details of the acetyl salicylic acid or aspirin. We have seen the pharmacological actions. We have seen the adverse effect. We have seen the uses of this acetyl salicylic acid, right? So after that we have seen the paracetamol. So paracetamol is nothing but the para-acetaminophenol, and it is having weak analgesic. It is a analgesic antipyretic but weak anti-inflammatory activity because it is ineffective in presence of peroxide. So peroxide level of inflamed tissue is higher. Whenever there is inflammation, जहाँ पे inflammation होता है वहाँ पे peroxide का level ज़्यादा होता है. So in the inflamed tissue there is a higher level of peroxides. So it is ineffective in case of inflammation. So therefore it is a analgesic antipyretic. It is a deethylated active metabolite of phenylalanine, or you can say phenylalanine is a prodrug of paracetamol. We have seen the adverse effect. So nausea, vomiting, diarrhea, there is a common adverse effect. But if you take paracetamol beyond 6 grams per day, it may damage your liver and kidney. Why? Because of the generation of a toxic metabolite known as N-acetyl para-benzoquinone imine. That is very important. इसके ऊपर 2000 बार क्वेश्चन आ चुका है. And that metabolite is removed by glutathione conjugation. So in case of toxic dose of paracetamol, so antidote for paracetamol poisoning is N-acetylcysteine, and another antidote is the methionine. They will provide the sulfhydryl groups to increase the glutathione level of your body so that toxic metabolite will be removed from body. We have seen this. We have also seen next pyrazolone derivative. In that you are going to have different drugs like pyrazolone derivative and a pyrazole, and a matlab kya 5-membered heterocyclic ring having 2 nitrogens, 1 2 nitrogen, pyrazole. So in that you are going to get aminopyrine, antipyrine, phenylbutazone, oxyphenbutazone. Oxyphenbutazone is the active metabolite of phenylbutazone, and other drug like phenyl dimethylpyrazolone, that is known as analgesic. So phenylbutazone is a potent anti-inflammatory drug, but it is rarely used because of its adverse effect like GIT, irritation, hepatic and renal. Then again hematological effect, matlab kya? So it will cause thrombocytopenia, etc. Oxypentothone is an active metabolite of phenylbutazone, will have the same adverse effect. Analgin again is a more potent analgesic antibiotic, but also having similar adverse effect of like a phenylbutazone, right? After that, we have seen the indole derivative. In that, you are going to have indomethacin, which is anti-inflammatory antibiotic analgesic, again particularly used in the swollen joint in case of arthritis and gout. Useful in acute attack of gout. Gout क्या होता है, arthritis क्या होता है, we are going to see tomorrow. Tomorrow we are going to see drug used in the arthritis, rheumatoid arthritis, drug used in the gout in the detail. Okay. So adverse reaction of indole or adverse reaction of indomethacin, इसके ऊपर बहुत बार क्वेश्चन आ चुका है. So adverse reaction of indomethacin is a frontal headache, right? So remember this is a NSAID which causes the pain. ऐसा एक NSAID है, ऐसा एक एनाल्जेसिक एंटीबायोटिक है जो खुद पेन देता है ना. तो remember this indomethacin causes the frontal headache as an adverse effect, followed by giddiness, mental confusion and blurring of vision. That's why it is contraindicated in case of drivers and in machinery operators to prevent the accident, right? Again contraindicated in case of psychiatric patient with epilepsy and pregnant women and children, patient having kidney disease. So it is a contraindication. Used in the acute gout. Alkalizing spondylitis. So it is a alkalizing spondylitis. क्या होता है, आपका जो spine होता है, spinal cord, in that spinal cord vertebra जो वो fix हो जाता है. There is a decreased movement of vertebral columns in the spine. That's why that is known as alkalizing spondylitis. That is known as alkalizing spondylitis. Remember. Okay. Now next we'll see. Next is nothing but the Sulindac is a fluorinated derivative of indomethacin, and Sulindac is also a prodrug and has a longer duration of action. We have already seen yesterday this. I have repeated. Next drug is nothing but the. So remember paracetamol. If you take a paracetamol, also known as acetaminophen, so it has a strong analgesic as well as antipyretic effect, but it has a weak anti-inflammatory effect. Paracetamol is a weak anti-inflammatory, strong analgesic, strong antipyretic effect, right? Yeah. Next, heterocyclic aryl acetic acid derivative. इसके ऊपर GPAT 2023 में क्वेश्चन आ चुका. So examples of heterocyclic aryl acetic acid derivative, GPAT 2023, right? So example is a diclofenac. So diclofenac is routinely used nowadays. It has a greater and sustained activity than indomethacin. Indomethacin से ये greater activity, sustained action दिखाता है. Then naproxen is also there and other NSAIDs. So diclofenac is superior than indomethacin, naproxen, other NSAIDs. Diclofenac. Now adverse reaction क्या है? Major adverse effect of this diclofenac is a gastric irritation. क्या करता है ये? GIT को irritate करता है. So it can cause hyperacidity. It can cause increase in the ulcer formation. So diclofenac increases the gastric irritation, can cause ulcers. Again diarrhea, headache, dizziness, skin rash and blood dyschariasis. These are the adverse effects. Diclofenac is a preferential COX-2 inhibitor. इसको क्या बोलेंगे अपन? Preferential COX-2 inhibitor. We have already seen in the classification preferential COX-2 inhibitor. इसके ऊपर भी क्वेश्चन GPAT 2022 में आ चुका है. Now it is mainly used in the treatment of rheumatoid arthritis, joint pain. Rheumatoid arthritis means joint pain, severe osteoarthritis and alkalizing spondylitis. Now diclofenac का ही छोटा ब्रदर है, छोटा भाई है, कौन है भाई? aceclofenac. Now this aceclofenac is a congener, you can say, or it is a derivative of diclofenac. Now it has a certain advantages. जैसे diclofenac is a gastric irritant. Diclofenac will increase the ulceration. Diclofenac will irritate your GIT, will increase the acid. So aceclofenac is a highly selective COX-2 inhibitor, and amongst them, तो preferential COX-2 inhibitor में उस है ना, aceclofenac is a highly selective COX-2. It has a high selectivity towards the COX-2 as compared to COX-1, and this aceclofenac is converted into active metabolite known as a 4-hydroxy aceclofenac. इसका एक्टिव मेटाबोलाइट होता है 4-हाइड्रोक्सी एसिक्लोफेनाक. आपने बहुत सारा टैबलेट देखा होगा एसिक्लोफेनाक पैरास्टामोल का, है ना, जैसे डोल, है ना, जैसे होता है एसिनेक पी, और है ना जो जेरोडोल नाम का टैबलेट है एसिक्लोपी. तो ये सब क्या है, एसिक्लोफेनाक पैरास्टामोल का कॉम्बिनेशन है. तो हाईली सिलेक्टिव COX-2 इनहिबिटर, इट इज सुपीरियर देन डाइक्लोफेनाक. डाइक्लोफेनाक क्या करता है, आपकी GIT को इरिटेट करता है. नाउ एज डाइक्लोफेनाक irritate your GIT, so diclofenac is always prescribed along with the either H2 receptor blockers or proton pump inhibitor. जब डाइक्लोफेनाक डॉक्टर आपको देगा तो उसके साथ में डॉक्टर जब when physician will prescribe you diclofenac, so it will be prescribed along with either PPI मतलब क्या, proton pump inhibitor like omeprazole, rabeprazole, esomeprazole, pantoprazole. So either it will indicate diclofenac is always given with the PPI. Why? Because it is a gastric irritant. It can cause hyperacidity. So always given with the PPI or histamine 2 receptor blocker. So histamine 2 receptor blocker कौन है? Cimetidine, ranitidine, famotidine. So either diclofenac is given along with these drugs. Diclofenac is always given with these drugs to prevent the acidity. Now aceclofenac is a congener of diclofenac. Aceclofenac उसका एक छोटा भाई है, highly selective COX-2 inhibitor. It is a converted into active metabolite 4-hydroxy aceclofenac. Now this aceclofenac, rather than irritation, it increases the hexamine level, cytoprotective hexamine level. aceclofenac क्या करता है कि इरिटेशन तो नहीं करता, लेकिन उसके बजाय उसके एडिशन क्या करता है, so it will not irritate your GIT, it will increase the cytoprotective hexam level in the stomach or GIT, cytoprotective hexamine level. So इसका एडवर्स इफेक्ट जो है डाइक्लोफेनाक का, so it can cause ulceration. Diclofenac can cause peptic ulceration that is not caused by aceclofenac. That's why nowadays aceclofenac is getting more popularity, right? Now next drug है ketorolac. Ketorolac is only drug which is available for intravenous injection. Remember, ketorolac is the only drug, only NSAID which is available for intravenous injection. Ketorolac is the only NSAID available for intravenous injection. Now it is as effective as morphine in a surgical and chronic cancer pain. Like other NSAID also inhibit the platelet aggregation, and it has a less anti-inflammatory activity. It is equipotent as morphine as analgesic but less anti-inflammatory. Next, aryl acid derivative में आता है tolmetin. So again aryl acid derivative. Aryl मतलब benzene. It will resemble to ibuprofen in its action. Then next आता है analgesic. It can cause agranulocytosis. agranulocyte का लेवल कम कर देगा. Indomethacin diclofenac can cause aplastic anemia. इंडोमेथासिन डाइक्लोफेनाक ये क्या है, इनके एडोसिपेट है aplastic anemia. इंडोमेथासिन एंड डाइक्लोफेनाक कैन कॉज aplastic anemia. तो रिमेंबर यहाँ पे याद रखना है आपको ये चीज, वेरी इंपॉर्टेंट. ओके, आफ्टर दैट नेक्स्ट वन इज अ प्रोपियोनिक एसिड डेरिवेटिव. इसमें आता है आपका आइबुप्रोफेन, फेनोप्रोफेन, नेप्रोक्सेन. तो आइबुप्रोफेन, फेनोप्रोफेन, नेप्रोक्सेन, देन flurbiprofen, ketoprofen. So ibuprofen, naproxen, phenoprofen, flurbiprofen, ketoprofen, they are also NSAIDs, analgesic, antipyretic and anti-inflammatory drugs. Similar to aspirin, but they are better tolerated. इनका थोड़ा सा toleration अच्छा होता है, right? So remember, ibuprofen is a racemic mixture. Ibuprofen is a racemic mixture, and yes, isomer is more potent. Ibuprofen is a racemic mixture, RNase isomer होता है इसका, but yes isomer is a more potent. Ibuprofen is a racemic mixture, yes isomer is a more potent. Naproxen, no, this flurbiprofen is used as a ocular anti-inflammatory. ये eyes में use की जाती है. See the ocular anti-inflammatory. Ketoprofen and other okay. Now adverse reaction of these drugs, they include GIT disturbances like epigastric pain, nausea, sense of fullness in the stomach, and then heartburn, मतलब acidity. Now it is used in the rheumatoid arthritis, osteoarthritis, and ankylosing spondylitis. Rheumatoid arthritis, osteoarthritis, and ankylosing spondylitis. देखो, flurbiprofen is an ocular anti-inflammatory drug and available as an eye drop. इसके ऊपर क्वेश्चन ऑलरेडी आ चुका है. Ibuprofen is the most tolerated drug among this category. सबसे ज्यादा टॉलरेटेड होता है ibuprofen. इसके इनहेंशियोमर होते हैं. नेक्स्ट ड्रग इज फेनामेट और फेनामिक एसिड डेरिवेटिव. Mefenamic acid, it is an anthralinic acid derivative useful in the chronic dull itching pain. Mostly they are used in a menstrual bleeding in case of dysmenorrhea. देखो, Nsaids like your mefenamic acid, fluphenamic acid. These are the two drugs. उसको बोलते हैं फेनामिक एसिड डेरिवेटिव और फेनामेट्स. So mefenamic acid is there and another is known as the fluphenamic acid. Fluphenamic acid. These two drugs, fluphenamic acid, mefenamic acid, fluphenamic acid. So they inhibit the prostaglandins. ये क्या करते हैं सभी NSAID prostaglandin को inhibit करते हैं. Formation of prostaglandins are prevented by these drugs. Now अगर ज्यादा prostaglandin, so if there is higher prostaglandins in the females में अगर ज्यादा prostaglandin हो गया तो उनके यूट्रस में क्या होता है, कॉन्ट्रैक्शन होता है. So increase the level of prostaglandins will increase the uterine contraction in the female that causes the bleeding known as the dysmenorrhea, right? So these drugs, by inhibiting the prostaglandin, they will decrease the symptoms of dysmenorrhea. That's why these drugs, mefenamic acid and fluphenamic acid, they are used in the treatment of dysmenorrhea. इसके ऊपर भी क्वेश्चन ऑलरेडी आ चुका है. Now oxycams, in that you have pyroxicam, tenoxicam, lornoxicam, and meloxicam, right? So they are the longer acting drugs. They are the longer acting drugs. They are the lornoxicam. All these drugs are the longer acting drugs. Meloxicam, tenoxicam, pyroxicam, they are the longer acting drugs. Again, their adverse effect is also similar to other classes. Like वही similar adverse effect होते हैं उनके, liver toxicity, skin toxicity, आपका है ना, irritation to GIT, nausea, vomiting. Why? Now next category is a selective COX-2 inhibitor. Next category क्या है? Selective COX-2 inhibitor. Now these drugs, they only inhibit the COX-2. These drugs, they will inhibit selectively to the COX-2, है ना. उसके पहले आता है preferential COX-2 inhibitor. Example क्या है? Nimesulide. Nimesulide is a less selective preferential COX-2 inhibitor. Now nimesulide, है ना, nimesulide. उसके बाद में after that meloxicam. Nimesulide, meloxicam, nabometon. Nabometon is a prodrug. Out of this nabometon जो है, it is a prodrug and it is converted into active metabolite known as a 6-methoxy-2-naphthalenic acid. So nabometon, meloxicam, nimesulide, they are the prodrugs. They are the preferential COX-2 inhibitor. तो आपका meloxicam जो है, nabometon जो है, nimesulide जो है, they are the preferential COX-2 inhibitor. But nimesulide is a less selective. And it is no more used. It is banned. We'll see in the commentary. Nimesulide is no more used from 2011. तो 2011 से इसका यूज नहीं कर रहे इंडिया में. Nimesulide will cause prominent hepatotoxicity as an adverse effect. That's why it is no more used in children. Then meloxicam, nabometon. So out of that, nabometon जो है, उसका nabometon is a prodrug. Nabometon is a prodrug. So converted into active metabolite known as a 6-methoxy-2-naphthalenic acid. 6-methoxy to naphthalenic acid, say 7A, 6-7A, याद रखना है. Now selective COX-2 inhibitor like your celecoxib, refocoxib, valdecoxib, eterocoxib, lot of drugs, celecoxib, valdecoxib, ropicoxib, valdecoxib, eterocoxib, है ना. So all these drugs are known as a selective COX-2 inhibitor. They are very good anti-inflammatory drugs because they inhibit the selective COX-2. तो COX-2 inhibitor जो है बहुत ही अच्छे anti-inflammatory drugs है. They are valuable anti-inflammatory drugs, but most of them are not used. Only few drugs are used. जैसे celecoxib हो गया, paracoxib हो गया, eterocoxib हो गया, तो refocoxib, valdecoxib, these are no more used. Why? Because ये जो selective COX-2 inhibitors है, they has a adverse effect. They adversely affect your cardiovascular system. So, like for example, ropicoxib and valdecoxib. Ropicoxib, valdecoxib, these two are the drugs known as a longer acting COX-2 inhibitor. Ropicoxib, valdecoxib, these two are the longer acting selective COX-2 inhibitor. They are also used as analgesic antipyretic in the osteoarthritis and rheumatoid arthritis. But most of them are not used. Why? Because they adversely affect your cardiovascular system. Remember, celecoxib is contraindicated in patient allergic to the sulfonamides. मतलब क्या है कि patient who are allergic to the sulfa drugs, they will show the cross allergy to the celecoxib. Then nimesulide का adverse effect क्या है? It has a nimesulide is a nephrotoxic and hepatotoxic. It is banned in many countries because of its adverse effect known as a fulminant hepatic failure or fulminant hepatic failure or fulminant hepatotoxicity. It is no more used in the children's also. So, children's now refocoxib, valdecoxib, they has been reported that they can cause increased risk of myocardial infarction and stroke. So ropicoxib, valdecoxib क्या करते हैं? Adversely affect your cardiovascular system. They can induce a myocardial infarction and stroke. That's why they has been globally withdrawn from the market from 2004. So as I told you, selective COX-2 inhibitor बहुत ही अच्छे analgesic antibiotic anti-inflammatory drugs है, but most of them are not used because they adversely affect the cardiovascular system, and that's why. Now paracoxib is a prodrug of valdecoxib, right? Paracoxib is a prodrug of valdecoxib. So now we'll see some important points from your same chapter, two different books. यहाँ पे थोड़ा सा इंपॉर्टेंट पॉइंट्स वगैरह आपको रिवाइज कर लेता हूँ. You see over here, थोड़े से पॉइंट्स देख लो आप यहाँ पे. We have almost covered all the things. अपने सभी देखा है ऑलरेडी, तो है ना. We already seen lot of things from NSAIDs. NSAIDs में most of the things अपने cover किए हैं, but still आपको कुछ points जो है you have to write down because these points are very important. Like for example, remember very important, paracetamol acts by inhibiting the selective, paracetamol act by inhibiting the COX-3 enzyme. Paracetamol act by inhibiting the COX-3 enzyme. Very important. Paracetamol acts by inhibiting the COX-3 enzyme. Very. So it is a selective COX-3 inhibitor in the brain and non-selective COX-2, non-selective COX inhibitor in the periphery. So paracetamol क्या है भाई? Paracetamol is a non-selective COX inhibitor in the periphery. Non-selective COX inhibitor in the periphery, but selective COX-3 inhibitor in the brain, and that action is also responsible for the antipyretic effect. याद रखना है आपको, very important, right? Now again, N-acetylcysteine is the antidote of choice in the paracetamol poisoning. Alternate antidote क्या है? Methionine, है ना? In case of paracetamol poisoning, antidote क्या है? N-acetylcysteine, and another antidote is the methionine. Both are the sulfur containing amino acid. Because paracetamol का एक मेटाबोलाइट बनता है, उसका नाम है N-acetyl benzoquinolamine, तो NABQI, right? Aspirin causes the Rett syndrome, है ना? Aspirin cause Rett syndrome, इसके ऊपर क्वेश्चन आ चुका है. Aspirin causes the Rett syndrome. So aspirin should not be used in the children's below 12 years of age to decrease the fever if there is a infection of influenza or varicella zoster. अगर viral infection है, if there is a viral infection, so aspirin should not be used. No. Aspirin should not be used in the patient in the children's below 12 years of age because due to risk of Rett syndrome. एस्पिरिन क्या करता है? इट इज इरिवर्सिबल इनहिबिटर ऑफ कॉक्स. याद रखना है, क्वेश्चन ऑलरेडी आ चुका. इरिवर्सिबल इनहिबिटर ऑफ कॉक्स ऑलरेडी ये कवर हो चुका है, बट सम पॉइंट्स आर रिमेनिंग, सो दैट्स व्हाई आई हैव हियर. एस्पिरिन एट अ लो डोज. एस्पिरिन का लो डोज मतलब क्या? यहाँ पे 40 तो 325 दिया है, बट यहाँ पे आप लिख सकते हो, है ना, 125 mg तक. That is antiplatelet. Low dose of aspirin is antiplatelet. High dose of aspirin causes the inhibition of prostaglandin. तो लो डोज में एस्पिरिन एज एंटीप्लेटलेट एक्ट करता है, हाई डोज में एंटी इंफ्लेमेटरी होता है, राइट? सुलिंडेक एंड नेबुमेट्रोन, दे आर द प्रोडक्ट, ऑलरेडी टोल्ड यू. तो यहाँ पे देखो, याद रखना है, इंडोमिथासिन क्या करता है? इट कैन कॉज हेडेक. तो एनाल्जेसिक कॉजिंग एंड सेडेशन. देखो यहाँ पे, है ना, फेनासिटीन इज अ प्रोड्रग ऑफ पैरासिटामोल. फेनासिटीन इज अ प्रोड्रग ऑफ पैरासिटामोल. Ketorolac is only NSAID which can be used intravenously. Ketorolac is only non-steroidal anti-inflammatory which can be used intravenously and available as eye drop also. Piroxicam, tenoxicam, they are the longest acting NSAID. Longer acting NSAID, piroxicam, tenoxicam. Okay. Oxaprozin is a new very long acting NSAID. अब ये पॉइंट आपने कवर नहीं किया है अपने. कौन सा? Oxaprozin. Oxaprozin is a very long acting NSAID. New. Then apazone. New drug A, apazone, new NSAID. Apazone has a uricosuric activity and indicated in the condition which is in which NSAID have failed. मतलब, you know, apazone is a drug used as a uricosuric, मतलब uric acid का excretion बढ़ता है. Uric acid excretion is increased by apazone. Useful in the rheumatoid arthritis and gout. नाउ प्रेफरेंशियल कॉस्ट इनहिबिटर में क्या आता है आपका, निमेसुलाइड, नाबोमेटोन, मेलोक्सिकैम. सो नाबोमेटोन इज अ प्रोड्रग and nimesulide is no more used because of its dominant hepatotoxicity, right? now selective cox inhibitors में आता है आपका, है ना, कौन से, पैराकॉक्सिब, एट्रोकॉक्सिब, सेलेकॉक्सिब, लुमीकॉक्सिब, ना, लुमीराकॉक्सिब. नाउ याद रखना है they have advantage. Selective cox inhibitor they have very little GIT toxicity, मतलब they will not irritate your GIT, but increased prolonged use of these selective cox inhibitor. Okay, so they have another adverse effect known as thrombosis. They can cause stroke and myocardial infarction, है ना. जैसे फॉर एग्जांपल आपका, है ना, रोफेकॉक्सिब and valdecoxib, they are withdrawn from the market because of the stroke and myocardial infarction as an adverse effect. तो याद रखना है, सेलेकॉक्सिब, रोफेकॉक्सिब, valdecoxib are sulfonamide derivative and they can cause a reaction and hypersensitivity. इनके सेलेकॉक्सिब, एक कॉक्सिब के अंदर क्या है, सेलेकॉक्सिब, रोफेकॉक्सिब, valdecoxib, they are sulfonamide derivative. They can exhibit a cross hypersensitivity to the sulfur drugs. Then eterocoxib is a long-acting coxib. Lumiracoxib is a new selective cox inhibitor, more activity in the acidic medium. Paracoxib is a product of valdecoxib. यहाँ पे ये कुछ पॉइंट्स है, याद रखना है. तो ऑल NSAIDs जितने भी नॉन स्टेरॉइडल एंटी इंफ्लेमेटरी है, all are the weak acids. They are the weak acidic drug except nabometon. All NSAIDs are the weakly acidic drug except nabometon. All NSAIDs are the racemic mixture. देखो, all NSAIDs are the racemic mixture except naproxen. Naproxen is present as a single inhalation. Diclofenac does not have any chiral activity. डाइक्लोफेनाक में कोई कायरल सेंटर है ही नहीं. नेफ्रोटॉक्सिसिटी एंड हिपेटॉक्सिसिटी में आपको तो एनी एनएसआईडी, मतलब जितने भी नॉन स्टेरॉइडल एंटी इंफ्लेमेटरी ड्रग है, जितने भी एनालिसिक एंटीबायोटिक है, सब क्या कर सकते हैं, नेफ्रोटॉक्सिसिटी एंड हिपेटॉक्सिसिटी. टोलमिटिन is not effective in the gout. Aspirin is less effective in the localizing spondylitis, right? So tomorrow we'll see the arthritis. इसमें अगर किसी को डाउट है तो कमेंट बॉक्स में डाउट, आप यू कैन आस्क योर डाउट इन द कमेंट बॉक्स. दिस वन इज अ बुक. उसके बाद में और भी एक दो बुक है, जैसे आपका ये, तो लाइक दिस. You can ask your doubts in the comment box. So actually you are going to, आपको मैं जो कंटेंट प्रेजेंट करता हूँ, आपको जो मैं कंटेंट एक्सप्लेन करता हूँ, ये सभी कंटेंट जो है एक्चुअली इट्स नॉट फ्रॉम वन बुक. ये बहुत सारे बुक्स का ब्लेंड है, बहुत सारे बुक्स का एसेंस है, बहुत सारे बुक्स का रेफरेंस बुक का ये क्या है, मिक्सचर है. सो यू आर गोइंग टू गेट, यू आर गेटिंग, है ना, आपको जो मिल रहा है वो सब क्या है, एसेंस है, समरी है, एक्सट्रैक्ट है, सभी बुक्स का आपको मिल रहा है, एक बुक का नहीं है ये सब, है ना. याद रखना है, इम्पोर्टेंट चीज़ें है, वट एवर जो चीज़ें मैं डिस्कस करता हूँ वो बहुत ही ज़्यादा इंपॉर्टेंट होती है. सभी बुक्स पढ़ने के बाद, सभी चैप्टर्स को ओवरलुक करने के बाद, बिफोर टेकिंग योर सेशन आई यूज टू रीड दीज बुक्स, ऑल दीज बुक्स इंक्लूडिंग योर KD त्रिपाठी, सातशेखर भंडारकर, ये सभी बुक्स को मैं पढ़ने के बाद में ही आपको ये पढ़ाता हूँ. ठीक है, तो आपको जो है ना सभी बुक्स का एसेंस मिलता है, सभी बुक्स का एक्सट्रैक्ट मिलता है. तो दैट्स वाई आपको सेशन मिस नहीं करना है ना, क्योंकि नोबडी विल एक्सप्लेन इन सच ए मैनर, है ना. किसी को कोई लेना देना नहीं है भाई, यहाँ पे सिर्फ अपना अपना टाइम निकालते हैं लोग बस, है ना. वैसा नहीं मेरा कि मैं प्रॉपरली आप कौन सी बुक में जाकर देखो, वही चीज़ें आपको मिलेंगी. ठीक है, वही चीज़ें आपको मिलेंगी, बाकी कुछ, है ना, ताकि कुछ भी छूटे ना, इसलिए मैं सभी आपको लेना. ठीक है, यहाँ पे भी आप, यहाँ पे एक इफ़ यू वांट टू सी, यहाँ पे आप देख सकते हो, तो यू कैन सी ओवर तो इसे सैलिसिलिक एसिड इज यूज्ड एज अ 6% ऑइंटमेंट एज अ कैरेटोलाइटिक. सो कैरेटोलाइटिक यूज है उसका, इट इज यूज्ड एज अ कैरेटोलाइटिक. तो कैरेलिन नाम का एक ब्रांड है, 3% इज ऑल्सो यूज्ड एज अ कैरेटोलाइटिक. डाइक्लोफेनेक का जेल आता है एज अ लोकल पेन किलर. डाइक्लोफेनेक का जेल क्यों आता है? घुटने में चोट लगी है. सो ओवेरान जेल इज अ ट्रेड नेम. पायरोक्सिकैम का भी जेल आता है 0.5%, उसको नाम है डोलोनेक्स. डोलोनेक्स का टैबलेट भी आता है, डोलोनेक्स और पायरोक्स जेल. डोलोनेक्स का टैबलेट आता है पायरोक्सिकैम 10 मिलीग्राम का. ibuprofen, flurbiprofen is a ocular anti-inflammatory drug. तो ऑक्यूफ्लो को याद रखना है. ये सब ब्रांड नेम भी कभी कभी एक आध बार ब्रांड नेम का भी क्वेश्चन आता है आपको. ब्रांड नेम भी एक बार ले करो, ब्रांड नेम भी एक बार मालूम होना चाहिए आपको. सो मोस्ट ऑफ द जहाँ पे लगता है कि मुझे ये इंपॉर्टेंट है तो वो ब्रांड नेम मैं यहाँ पे इंक्लूड करता हूँ. ठीक है. तो वी हैव सीन ऑल दिस थिंग्स. देखो एक टेबल है, ये टेबल आपको समरी. तो यू कैन रिवाइज होल चैप्टर बाय दिस टेबल. जैसे यहाँ पे आई होप यू आर गेटिंग, आई होप यू आर एबल टू सी दिस टेबल. यहाँ पे देखो एक टेबल है, ये टेबल मैं आपको एक्सप्लेन करता हूँ. दिस टेबल इज इम्पोर्टेंट. NSAID प्रॉपर्टीज, एडवांटेजेस एंड यूजेस. इन शॉर्ट सभी समरी क्या है चैप्टर का वो सब. तो एस्पिरिन, तो एस्पिरिन क्या है? इट इज अ एसिटिल सैलिसिलिक एसिड. So it is a good analgesic, antibiotic, anti-inflammatory, also uricosuric drug, higher dose. Uricosuric मतलब क्या? It will increase the excretion of uric acid from the blood. तो इसके advantage है antiplatelet activity is seen only in a low dose. It is a powerful anti-inflammatory activity in a higher dose. Use क्या है इसका? As analgesic for a headache, है ना, headache, backache, neuralgia. Neuralgia मतलब क्या? nerve pain, dysmenorrhea, pyrexia, rheumatic fever, rheumatic, psoriatic and osteoarthritic and for antiplatelet activity also. In post-stroke, so it is used in the prophylaxis of myocardial infarction, to closure the patent ductus arteriosus, to delay the labor. Now paracetamol है good analgesic, antibiotic, लेकिन poor anti-inflammatory. Good analgesic, antibiotic but less anti-inflammatory, poor anti-inflammatory. So paracetamol will cause less gastric irritation and it is analgesic action in fever also. Use क्या है? analgesic and antibiotic. Then diclofenac क्या है? तो analgesic, antibiotic, anti-inflammatory. Good concentration in the synovial fluid. So most of the joint pains they are treated by diclofenac, है ना. So chronic inflammatory conditions like rheumatoid arthritis, osteoarthritis, acute musculoskeletal pain and post-operative pain, है ना. Acute papillitis and acute peritopical abscesses. इसके एडवर्स इफेक्ट भी क्या है? माइल्ड है, जैसे गैस्ट्रिक इरिटेशन एंड, है ना. एक याद रखना है कि ड्यू टू गैस्ट्रिक इरिटेशन, देखो डाइक्लोफेनेक इज अ गैस्ट्रिक इरिटेंट. ड्यू टू इरिटेशन ऑफ गैस्ट्रिक म्यूकोजा समटाइम्स देयर इज अ गैस्ट्रिक ब्लीडिंग. गैस्ट्रिक ब्लीडिंग भी हो सकता है. तो GIT में क्या कर सकता है? ये ब्लीडिंग कर सकता है, कैन कॉज गैस्ट्रिक ब्लीडिंग. और गैस्ट्रिक में ब्लीडिंग होगा ना, गैस्ट्रिक ब्लीडिंग होगा तो इट विल स्टेन योर फीसेस. आपका जो फीसेस है, आपकी जो टट्टी है उसको स्टेन करेगा. कैसे? है ना, उसको स्टेन करेगा ब्लैक कलर पीसेस. तो यू कैन, है ना, मतलब आपको ब्लैक कलर के पीसेस आ गए, मतलब आपकी टट्टी ब्लैक कलर की आ गई, तो उससे एक चीज याद रख सकते हो, देयर माइट बी गैस्ट्रिक ब्लीडिंग. तो ड्रग विच कॉजेज द गैस्ट्रिक ब्लीडिंग that can cause black color pieces. Now pyroxicam, so pyroxicam is oxycam derivative, analgesic, antibiotic and anti-inflammatory, long acting होता है. So once a day dose is enough. Less ulcerogenic मतलब अल्सर कम करता है, better tolerate. Again used for the same arthritis, musculoskeletal pain and post operative pain. Next drug है आपका phenylbutazole. So again good एंटी इन्फ्लेमेटरी है, Analgesic antibiotic. Salt and water retention is the adverse effect. It can cause edema and toxic. It is more toxic than aspirin. Again, useful as an analgesic anti-inflammatory agent. Used in the rheumatoid arthritis, gout, osteoarthritis, ankylosing spondylitis. Indomethacin, again, it is a good analgesic, anti-inflammatory and antibiotic, but it is a toxic in a high dose. It is a potent analgesic, anti-inflammatory and a drug. Used in the again rheumatoid arthritis, psoriatic pain, arthritis, gouty, ankylosing spondylitis. And remember, very important use of this indomethacin. इंडोमिथासिन का एक बहुत ही इंपॉर्टेंट यूज है, क्या है, टू क्लोज द पीडीए. पीडीए मतलब क्या, पेटेंट डक्टस आर्टरियोसिस. टू क्लोज द पीडीए मतलब जो है ना, व्हेन बेबी इज डिलीवर्ड, सो इफ दैट डक्टस आर्टरियोसिस इज नॉट क्लोज्ड, इट इज नॉट द पेटेंट डक्टस आर्टरियोसिस, that should be closed. To close that, indomethacin, aspirin, they are used. Ibuprofen मतलब again it is an propanic acid derivative and analgesic antibiotic. All action are milder than aspirin. Adverse reaction कम है इसके and therefore better tolerated. So again used for the same. तो याद रखना है कि ये just you can revise the table. You can revise all the drugs. ऐसे टेबल जो होते कंपैरिजन के, वो भी कभी उसके ऊपर भी क्वेश्चन आता है. तो tomorrow we'll see the drug used in the rheumatoid arthritis. So I hope everybody has understood. समझ में आपको? I hope everybody has understood. So we'll see remaining points tomorrow. Tomorrow we'll see the drug used in the treatment of rheumatoid arthritis and gout. So and also we'll try to complete the medicinal chemistry of this tomorrow itself. इसका medicinal chemistry कल ही ले लूँ मैं. medicinal chemistry अभी जितने चैप्टर हो चुके आपके, उसका सबका medicinal chemistry अभी डिस्कस करेंगे. After the gout and arthritis, we'll discuss the medicinal chemistry of all chapters whatever we have seen, है ना. And tomorrow you are going to have one test on, है ना, test number 2 on carbohydrate and lipids. तो मैंने कुछ एडिशनल क्वेश्चंस भी पिकअप किए हैं, तो कल आपके लिए एक टेस्ट भी हो जाएगा उसके. तो कल एक 45 मिनट का टेस्ट मैं अपलोड कर दूंगा. एंड टुमारो यू हैव टू अटेम्प्ट दैट टेस्ट, है ना. द क्वेश्चंस व्हिच आर ऑलरेडी इन टेस्ट 1 एंड टेस्ट 2, जो टेस्ट 1 हुआ है कार्बोहाइड्रेट एंड लिपिड का, वो क्वेश्चन इसमें नहीं है, ये अलग क्वेश्चन है. आई हैव पिक्ड मोर क्वेश्चंस. जो टेस्ट 1 में जो क्वेश्चंस थे वो नहीं है. एंड अगर आपने टेस्ट 1 नहीं दिया है तो जाके देना है आपको. एवरीबडी जस्ट गो एंड ऑल अटेंड ऑल द टेस्ट. अगर टेस्ट एक्टिव नहीं तो मुझे बोलो, मैसेज करो, आई विल रीएक्टिवेट इट. बट आप कोई बोलते ही नहीं हो. जीपैट ऐसे ही नहीं होंगी, आपको लड़ना पड़ेगा, मेहनत करना पड़ेगा. Tomorrow we'll see the anti-gout drug, drug used in the gout, drug used in the treatment of arthritis, and also we'll see the medicinal chemistry of Nsaids. Okay? So your Nsaids chapter from pharmacology point of view is completed.